Jackman, Maine is a very remote area. We're essentially an island up here. If you look behind me, that represents pretty much so in any direction what we're dealing with.
Jackman is a pretty unique part of Maine and pretty unique piece of America in terms of the healthcare needs and the community that healthcare there serves.
Medical care in this community is a challenge because we are 75 miles away from the nearest emergency room or hospital. So it's important that we can do what we can here in Jackman and be able to treat people the best way we can.
The fact that a patient can go to that health center and meet with that paramedic, and that paramedic can bring up all kinds of medical professionals through telehealth and FirstNet, and be able to communicate with them and assess a patient for whatever they need and direct the patient in the right area, prescribe medications, is just phenomenal. If that wasn't there, anybody coming in, bringing a family member, friend, whatever, injured, ill, they would have no choice but to drive to the nearest hospital, which is 50 miles away, and most often they go south towards the hospital, which is 75 miles away.
The paramedics, they have their phone, and then they also have tablets that are using the FirstNet service to be able to communicate, which is important here just because the internet service, cell service is all very spotty.
The technology piece has been interesting. Being able to interface with that physician is really the underlying foundation of what we're doing up here. EKG machines or monitors, and able to take that information and send it, again, securely to the physician so they can actually see the assessment portion of what we're doing here in the field.
This is new, this is innovative. The people of the town of Jackman are rural and need access to health care. The key to this is that the paramedics work under a delegated practice in telehealth, which is the absolute key starting at 5:30 at night during the week, is that the paramedics establish a telehealth connection with an emergency room physician at St. Joe's, and they work collaboratively together to care for the patient and get them what they need. By doing that, we're able to care for patients in an emergency situation using our regular EMS protocols, or we're able to care for the patients for relatively minor but things that need to be taken care of right away to prevent a condition getting worse. And that's an essential piece of that.
For communities that lose access to healthcare and schools, those are the two best predictors for the communities to dissolve, to fall apart. Without easy access to healthcare, communities don't hold together. And so as financial and operational and staffing pressures have fallen onto the Jackman Clinic, just as they have pretty much everywhere else in the US, they've had a need to create access for patients that maintains what's been necessary to hold the community together.
This is really exciting for me because it just opens another door.